Welcome back, everybody, to the Deep Dive. This time, we're going to take a deep dive into the world of telemedicine.
Oh, yeah.
And we'll be guided by Jörg-Owe academic paper on the topic.
Yeah, a great paper, by the way.
Yeah. And we're really going to try to understand how this stuff works. You know, it's not just the tech behind it, but all the potential benefits and drawbacks and like why this matters so much right now.
Yeah, especially now.
Especially now.
Yeah, after, we all went through the pandemic and everything.
Totally.
I think one of the most fascinating things that Schneppet points out is that telemedicine, it's not like one single thing.
Oh, interesting.
Yeah, it's not like this silver bullet that's going to replace all doctor's visits. It's more like this evolving toolkit with all sorts of different tools for different situations.
That's a good way to think about it.
Yeah.
So where do we even begin with this toolkit? I mean, Schnepp outlines all these different types of telemedicine, each with its own, applications.
Yeah, it's like a whole menu of options, right? Well, you could say the most basic form is the classic remote consultation.
Okay.
That video call with your doctor.
Right.
But from home or wherever you are.
Yeah, like my therapist does that.
Exactly. And Schneppet really highlights how this seemingly simple thing can make a huge difference.
Oh, how so?
Well, think about people in rural areas.
Right.
Or people with mobility issues.
They can't always get to a doctor easily.
Exactly. So telemedicine can really open up access to healthcare for them.
Yeah, that's kind of amazing when you think about it. It's like democratizing healthcare in a way.
Absolutely.
But Schneppet doesn't stop there, right?
Oh, no. He goes way beyond that.
Okay, so what else is there?
Well, he dives into some really cutting-edge stuff, like remote monitoring. Think wearable sensors,
Like a Fitbit.
Yeah, like a Fitbit, but even more advanced.
Okay.
Constantly tracking your vital signs and sending that data back to your doctor.
Wow.
Schneppet argues that this could revolutionize the way we manage chronic conditions like diabetes or heart disease.
Yeah, that makes a lot of sense.
You're getting this continuous stream of data.
It's like having a doctor with you 24/7.
Exactly.
Always keeping an eye on things.
It's pretty amazing when you think about it.
It is pretty amazing. What else does Schnepp talk about?
Well, he also delves into teletherapy, which has become so important, especially, over the past few years.
Yeah, for sure.
Providing mental health support online.
Right.
Schnepp points out how this not only increases access to care, but it also helps to reduce the stigma that's often associated with seeking help.
It's like you can get help from the comfort of your own home.
Exactly.
Without having to go to a therapist's office.
It can be much less intimidating for some people.
For sure. And Schnepp even talks about how telemedicine is being used in emergency care.
Yeah, that one surprised me too.
Yeah. I mean, you wouldn't think telemedicine would be helpful in an emergency situation.
Right.
Yeah.
But Schnepp says it can be really valuable for triaging patients remotely.
Oh, so like if you call 911, they can walk you through what to do while you wait for the ambulance.
Exactly.
Or even help determine if you even need an ambulance.
Exactly. It's about using technology to provide guidance and support in those critical moments.
So even in emergencies, telemedicine can be a lifesaver.
Potentially, yeah.
And it's not just about real-time interaction either.
Right. Schnepp also talks about asynchronous telemedicine.
Asynchronous, what's that?
It's basically secure messaging with your doctor.
Oh, so like emailing your doctor?
Kind of, but it's a secure platform specifically designed for healthcare communication.
So instead of playing phone tag, you can just send a quick message.
Exactly.
Okay, I like that.
Ask a question or get advice without having to wait for an appointment.
So it's all about making healthcare more convenient and accessible.
Exactly. And efficient.
So Schnepp has really thought this through. Like he's covered all the bases.
He really has.
But how does this all actually work in practice? What's the technology behind it all?
Yeah. Well, it's a mix of things, right? We've got video conferencing platforms, secure messaging apps.
Yeah.
But it goes deeper than that.
Okay.
Schnepp talks about all these remote monitoring devices.
Yeah.
From smartwatches that track your heart rate.
Right.
To implanted sensors that can relay data directly to your doctor.
Wow. So it's not just talking to your doctor online. It's like this whole network of devices.
Right. It's an interconnected system.
Yeah.
And of course, none of this would be possible without reliable internet access.
That's true.
Schnepp emphasizes that internet connectivity is the foundation of all of this.
It's amazing how technology is changing the face of healthcare.
It really is.
But let's move beyond the tech itself, and talk about the impact.
Right.
Why is all of this so important? Schnepp gives some real-world examples, right?
He does. He highlights the potential of telemedicine in a few key areas.
Okay, like what?
Well, let's start with mental health services.
Okay.
Schneepat points out how teletherapy has been a game changer for people who might not otherwise have access to mental health care.
Yeah, like if you live in a rural area.
Exactly. Or if you have transportation issues, or if you're just not comfortable going to a therapist office.
Right.
Teletherapy can break down those barriers.
It's like it's removing the stigma and making it easier for people to get the help they need.
Exactly. And Schneepat also highlights the impact of telemedicine on chronic condition management.
Okay.
Imagine someone with diabetes who needs regular monitoring.
Right.
Instead of constantly going to the doctor's office, they can use telemedicine for virtual check-ins, data tracking through connected devices, and, timely interventions.
It's like having a virtual support system.
Right.
It can really empower patients to take control of their health.
Absolutely. And Schneepat points out that this can actually lead to better health outcomes overall.
I can see that.
It's about giving patients the tools and support they need to manage their conditions effectively.
It's fascinating how telemedicine is kind of shifting the balance of power in healthcare, putting more control in the hands of the patients.
I agree. It's a really interesting development.
What other areas does Schneepat highlight?
Well, he talks about how telemedicine is revolutionizing follow-up care. Imagine having surgery and then being able to recover at home while still having those crucial check-ins with your doctor, all without having to physically go back to the hospital.
Yeah, that would be so much easier.
Exactly. It can make a huge difference in patient comfort and recovery time.
Yeah, for sure. And it probably frees up resources at the hospital, too.
Exactly.
What else?
Well, Schneepat also sees a role for telemedicine in preventive care.
Oh, interesting. Like what?
Think virtual wellness programs, online health assessments, personalized tips and advice delivered digitally.
Right.
It's about empowering people to take charge of their health proactively.
Yeah, instead of just reacting to problems after they arise.
Exactly. It's a shift towards a more preventative approach to healthcare.
That makes a lot of sense. And finally, what about access to specialty care?
Oh, yeah. Schneepat highlights how telemedicine can be a game changer for people who live in rural communities.
Right.
Or who lack access to specialized doctors in their area.
Yeah, because not every hospital has every specialist.
Exactly. So telemedicine can bridge that gap and connect patients with the experts they need.
It's amazing how technology is breaking down these geographical barriers.
It really is.
But with all these incredible benefits that Schneepat talks about, it seems almost too good to be true.
I know, right?
Are there any downsides to telemedicine? Are there any challenges?
Of course, like any new technology, telemedicine has its challenges.
Okay, like what?
Well, one of the biggest concerns that Schneepat addresses is the issue of accessibility.
Right. Not everyone has access to the internet or to the devices they need to participate in telemedicine.
Exactly. We can't let telemedicine create a new digital divide.
Right. It has to be accessible to everyone.
Absolutely. And beyond access, there are also technological barriers.
Like, what do you mean?
Well, the software can be complex.
Yeah.
Devices might have compatibility issues.
Oh, yeah, I've had that problem before.
And not everyone is tech savvy.
Right. Some people might struggle to use the technology.
Exactly. So there's definitely a learning curve involved for both patients and providers.
We need to make sure everyone feels comfortable navigating this new landscape.
Absolutely. We can't leave anyone behind.
What other challenges does Schneepat talk about?
Well, he also brings up the issue of data privacy and security.
Yeah.
When we're talking about sharing sensitive health information online,
Yeah.
there are always concerns about data breaches
Of course.
and unauthorized access.
So how do we address that?
Well, Schneepat emphasizes the need for robust cybersecurity measures and clear guidelines to protect patient data.
We can't sacrifice privacy and security for the sake of convenience.
Exactly. It's a delicate balance.
What other potential pitfalls does Schneepat identify?
Well, another challenge he highlights is the lack of integration and standardization across different healthcare systems.
What do you mean?
Well, for telemedicine to really thrive, we need seamless communication and data sharing between hospitals, clinics, pharmacies, insurance providers.
Nice. It all has to work together.
Exactly. It's a complex web of interconnected systems.
And it sounds like we still have some work to do to get all those systems talking to each other.
We do, but progress is being made.
Are there any other factors that could hinder the adoption of telemedicine?
Schneepat also delves into some of the socioeconomic factors that can't be ignored.
Like what?
Well, even if we bridge the digital divide and provide access to technology,
Yeah.
there are still issues of digital literacy and comfort with technology.
Right. Not everyone is comfortable using computers or smartphones.
Exactly. So telemedicine needs to be user-friendly and accessible to everyone,
regardless of their tech skills or their background.
Absolutely. It's about equity and inclusivity.
It's making sure everyone has an equal opportunity to benefit from these advancements.
Precisely.
Okay. But I can't help but think about, the elephant in the room.
Oh, yeah.
The COVID-19 pandemic.
Right.
How did that global health crisis impact the world of telemedicine, according to Schneppat?
Well, the pandemic was a watershed moment for telemedicine.
In what way?
Schneppat argues that it forced healthcare systems worldwide to rapidly adapt and embrace remote care on a scale never seen before.
Because suddenly in-person visits were dangerous.
Exactly. So virtual consultations became a necessity.
Right. It was a way to minimize contact and slow the spread of the virus.
Exactly. And what's interesting is that Schneppat observed that the pandemic didn't just accelerate the adoption of telemedicine. It also highlighted its benefits in a very tangible way.
So people were kind of forced to try it out.
Right.
And they realized, hey, this actually works pretty well.
Exactly. They experienced the convenience and accessibility firsthand.
So what were some of the specific benefits that came to light during the pandemic, according to Schneppat?
Well, first and foremost, telemedicine helped to reduce in-person contact, which was crucial in preventing the spread of the virus.
It allowed healthcare providers to continue seeing patients
Right.
without putting themselves or their patients at risk.
Exactly. And beyond reducing the risk of infection, telemedicine also ensured continuity of care during a very uncertain time.
Because even if you were sick or recovering from surgery, you could still connect with your doctor.
Exactly. You could receive medications, stay on track with your treatment plans,
without having to physically go to a healthcare facility.
It was really remarkable how telemedicine helped to keep the wheels of healthcare turning.
Yeah, even when the world felt like it was standing still.
It was a testament to the adaptability and resilience of the healthcare system.
It really was, and what's amazing is that Schneppat believes that this impact is going to be long-lasting.
Yeah, he thinks the pandemic was like this unexpected catalyst that propelled telemedicine into the mainstream.
It forced everyone to confront the possibilities.
And to overcome some of the barriers that were holding it back.
So where do we go from here?
That's a great question, and one that Schneppat explores as he delves into the future of telemedicine.
Okay.
He sees a future where telemedicine is seamlessly integrated into our lives, empowering us to take charge of our health and connect with healthcare providers in ways we never thought possible.
It's like a whole new era of healthcare.
It really is.
It's pretty exciting.
It is.
But before we get too caught up in the future, let's take a moment to reflect on what we've learned so far about this revolutionary field.
Yeah.
We've explored the various types of telemedicine, the technology behind it, its real-world applications, and its potential benefits and drawbacks.
We've covered a lot of ground.
We have. We've even discussed the impact of the COVID-19 pandemic and how it's reshaped the landscape of healthcare.
It's been quite a journey.
It really has. And now, as we look ahead to the future of telemedicine, I'm eager to explore the exciting possibilities and the potential challenges that lie ahead.
I am too.
But first, let's take a quick break. When we come back, we'll delve into what the future holds for this rapidly evolving field and what it could mean for all of us.
Sounds good.
Stay tuned.
So, stepping into the future of telemedicine here, one thing that Jörg-Owe Schneppat makes very clear is that this isn't just some,
passing fad?
Yeah, exactly. It's not going anywhere.
It's here to stay.
It's here to stay. And in fact, it's going to become even more deeply integrated into the healthcare system.
So it's not just a temporary fix. It's a fundamental shift in how we approach healthcare.
Exactly. Schneppat sees telemedicine evolving from, this crisis response tool that it was during the pandemic into this, core element of healthcare delivery.
So it's becoming part of the fabric of healthcare.
Yeah, exactly. Okay, so telemedicine is here to stay for the long haul. But what does that actually look like? What changes can we expect to see? What exciting developments are on the horizon?
Yeah. What does Schneppat say about that?
Well, first of all, get ready for a much smoother user experience.
Oh, that's good to hear, because I've had some, clunky experiences with telemedicine platforms.
Yeah, I think we all have.
Yeah.
But technology is always advancing.
Right.
And SCHNEPAT anticipates that we're going to see more intuitive, more user-friendly platforms.
So seamless video calls, streamlined interfaces.
Easy ways to share information between patients and providers.
It's like telemedicine is getting a much-needed makeover.
Exactly. And there's another really exciting development on the horizon.
Okay, tell me.
Artificial intelligence.
AI.
Yeah, AI.
Interesting. How does that fit in?
Well, SCHNEPAT highlights the growing role of AI in personalizing care and really, enhancing the capabilities of telemedicine.
Give me an example.
Okay, imagine AI-powered diagnostic tools that can analyze your symptoms, suggest potential diagnoses, and even recommend treatment options.
Wow, that's amazing. It's like having a virtual doctor in your pocket.
It really is, and the speed and the accuracy of AI is just incredible.
But with all this advanced technology, data, privacy, and security have to be a top priority, right?
Absolutely. As telemedicine evolves and handles even more sensitive data, SCHNEPAT emphasizes the absolute necessity for a really strong focus on cybersecurity and patient privacy.
So we're talking strong encryption, secure platforms, robust data protection measures.
All of that absolutely non-negotiable.
That's good to hear. It sounds like SCHNEPAT is advocating for a balanced approach, embracing innovation, but also making sure that patient safety and well-being are never compromised.
Exactly. It's about finding that sweet spot.
Yeah. And what about the financial side of things? What does SCHNEPAT see happening with investments in telemedicine?
That's interesting, actually. SCHNEPAT believes that the initial sort of gold rush of investment in telemedicine that we saw during the pandemic, that's starting to level off a little bit.
So it's not just about throwing money at every shiny new telemedicine startup anymore.
Not anymore. Venture capitalists are becoming more discerning. Now they're looking for telemedicine companies that have,
a solid business model.
Yeah, a solid business model, a clear path to profitability.
They're looking for companies that are in it for the long haul.
Exactly. Companies that can actually deliver high-quality, sustainable care.
So it sounds like the future of telemedicine is both exciting and challenging. We have these incredible opportunities to really transform healthcare.
Right.
To improve access, personalize care, leverage cutting-edge technology.
But we also have to be mindful of the challenges.
Right.
The data privacy, the equity, the need for seamless integration with all these other systems.
With what to consider.
It's complex, but it's also incredibly promising.
So telemedicine is this powerful tool.
Yeah.
With the potential to really revolutionize healthcare.
If we use it wisely.
Exactly. We have to be thoughtful about how we implement it and how we address the challenges.
It's not a magic bullet that will solve all of healthcare's problems overnight.
Right.
But it's definitely a crucial piece of the puzzle.
As we move towards this more accessible, more efficient, more patient-centered future.
Absolutely.
Well said. SCHNEPAT really paints a compelling vision of this future, where telemedicine is seamlessly integrated into our lives, where we have more control over our own health and well-being, and where we can connect with healthcare providers in ways that we never thought possible.
It's a very exciting time to be alive.
It really is.
And to be a patient.
Right. And the most exciting thing is that we're really just at the beginning of this telemedicine revolution.
Yeah, who knows what incredible advancements and breakthroughs are waiting for us just around the corner.
It's amazing to think about.
It is.
But before we get too carried away dreaming about the future, let's take a moment to recap what we've learned from SCHNEPAT's insights. We've talked about the different types of telemedicine, the technology that powers it,
all right,
the real-world applications,
the potential benefits and drawbacks,
the impact of the pandemic.
It's been quite a journey.
It really has. But now I want to shift the focus from the theoretical to the personal.
Okay.
We talked a lot about the big picture.
Yeah.
But now I want to bring it back to you, the listener. So what role do you see telemedicine playing in your future, healthcare journey? We've talked about all these trends and possibilities.
Yeah.
But as Jörg-Owe SCHNEPAT suggests, telemedicine is all about giving people the power to take control of their own health.
That's really the key, isn't it? It's about making informed choices. Exploring these new options.
Yeah.
Figuring out what works best for you.
Exactly. So let's get personal for a minute here.
Right.
Think about your own situation. Maybe you live in a rural area.
Right.
And you've had trouble accessing specialists in the past. Could telemedicine be that bridge that connects you with the care you need.
It could be a game changer.
Yeah, you could get the care you need right from home.
Exactly. Schneepat really emphasizes that point. Telemedicine can adapt to all sorts of different lifestyles and needs.
Yeah, it's about removing those barriers of time and distance.
Right.
Making healthcare more convenient, less disruptive to your life.
Or maybe you just value the privacy and comfort of receiving care in your own space, on your own terms.
That's a good point.
Telemedicine gives you that option.
Yeah.
It's not one size fits all.
Right.
It's about expanding your choices.
Giving you more control.
Exactly. As Schneepat points out, it's this patient-centric approach that's really key to the future of healthcare.
So as we wrap up our deep dive into the world of telemedicine, guided by Schneepat's work, we want to encourage you to stay curious, explore these possibilities, and really consider how telemedicine might fit into your own healthcare journey.
And remember, this is just the beginning.
Oh, yeah.
The future of telemedicine is just, it's wide open with potential, and who knows what incredible advancements are just around the corner.
It's an exciting time to be a patient, that's for sure.
It really is.
Well, thanks for joining us on this deep dive into telemedicine.
Yeah, thanks for listening.
We'll catch you next time for another exploration of a topic that matters.